I know you've been doing this for a few years now, but more public facing with high exposure factor for maybe a year and a half or so. How long do you give a therapy with no factors changed in any other subcategory of what you're doing with yourself lifestyle wise to actually give it a shot so there's no contraindications, there's no
Yeah.
cross contamination of results, etc.?
We usually try to replicate papers.
Okay.
Yeah, I guess like as a baseline to understand what we did at Blueprint, it's really pretty simple. We looked through every single health span and lifespan study ever done.
Hmm.
We ranked them according to effect, and then we graded the evidence. And we said, can we take all the power laws of all the scientific evidence ever done and implement them in me as an experiment to say, where are we at with the science of anti-aging? And then we did that. We put that into a family of Blueprint products for others to consume. And I think it's an interesting question. If you just say, in the year 2024, where are we at? And so, we played the power law game. And so if something's down on like the 100 or 200 level spot, and there's thousands of those things, we typically don't even pay much attention to it. And so because it's just too much effort, the evidence doesn't cross a certain threshold. And
so with that being said, though, how do you justify implementing things that are experimental research chemicals? Because sometimes you will implement something like a epitalon for potential telomere lengthening properties, but it's like didn't even pass FDA approval. Not that that's the end all be all, of course, but sometimes there'll be things being implemented that are like legitimately not founded in trials with no like efficacious dose really established for humans with a set duration of exposure. But then there'll be certain kind of like tried and true things that maybe don't meet the criteria too. And then people are left wondering, did this not make it? But then these things that they're the most exotic things possible that typically only a bodybuilder who's high risk or a biohacker would go try.
We grade these things according to their safety profile and then the potential effect size and then the ease of implementation. And so, for example, what's one? Oh, so doing the Thymus rejuvenation was really hard. It took us probably 6 months. So the HGH was easy. That's easy to get an RX. But then the MRI and doing the computational reconstruction of the thymus was really hard. We had to employ 2 specialists and write our own code to do that. So it was just the entire project. And we thought it was interesting. So even though it didn't rank on the power laws in our initial research, we thought thymus rejuvenation was so interesting and so powerful, it was worth a shot.
So there's a novel factor as well that has to be accounted for. It's not just
exactly.
Okay.
Yeah. So I mean that's a really good summary. Like we did the power law thing, but then we also carve out these unique paths where we think
no one else is going to test it.
Exactly. And like if we actually do something interesting, could it have a huge difference?
Sure.
And does it have a safety profile that we're comfortable with? And so we have carved out these unique paths. Now, of course, when you're doing that, everyone's going to have their own observations and opinions on what is safe, what the potential effect size is, et cetera. It's just an endless debate of disagreement. And so we take our best go of what hits where, and we have a go at it.
See, it's really interesting, though, because it's almost paradoxical to the whole motto of don't die, because this is your number one primary goal above all else is stay alive. But then yet you will justify the risk to reward as a clear positive on like very exotic, unproven chemicals sometimes. And I'm not to judge. Like I've certainly taken my fair share of random stuff that's not made it even through phase 2 trials. Not as much nowadays, but when I was younger, that was something, I'd be willing to take cardarine, which is like a super enhancer of endurance, but caused cancer at every dose in rodent studies and got canceled in clinical development. Like that's the kind of stuff I was willing to take back then, but now I'd say, hell no. So I'm just like trying to make sense of the logic or the risk aversion or lack thereof. Like I suppose the novelty factor and how fun it is can supersede the don't die, and you think the risk to reward, the risk isn't as high as perhaps, other people might perceive it to be, I suppose.
Yeah. I don't think we've never done anything that compromises safety.
I don't know, man. Like some of the drugs, like oral minoxidil.
Tell me what do you think is the risk profile of that, and why would you be?
I don't think it's super high, but when it's in accordance with all the other things, many of which are cardiovascular modulating, and you already have a resting heart rate that is so low and presumably a pretty low blood pressure too, and it's used as a primitive hypertensive anti-agent. And there's just so many cases of arrhythmias, edema, like all these things that for the upside of potential, I don't know, like some cosmetic difference in hair count that maybe is slightly better at the microdose than you would have got from topical. And you could have just got a transplant, which is inconvenient, but risk-free short of the actual surgical procedure, but isn't an extra drug. Like, to me, I'm thinking, if I'm Bryan, I'm doing transplant over a black box warning drug.
Yeah. Yeah, I guess the way our team thinks about this, and I say our team because I do rely upon them for these decisions, is we did a pretty extensive analysis of the risk profile. The dosage I'm doing is 2.5 milligrams, and the team thought it was basically a benign approach to doing it. And so we saw that the risk factors were primarily in those with with high blood pressure, but those that didn't, the risk profile didn't seem to be excessive. And so yours, I guess what I found is like someone else's assessment may grade minoxidil 2.5 milligrams in a higher risk category. And it's just a difference of scoring the risk of each different intervention.
Yeah.
And I respect that. I mean, the data's out there and people take different approaches to how they evaluate it. And whether we score low and someone scores high, that's just the game. But we generally have not made any decisions that we thought were created unnecessary risk.
Are you opposed to, because I can understand the desire to achieve results with endogenous processes to kind of show that it's your biology facilitating it. So reversing hair loss, obviously very difficult once you miniaturize to a certain point. And if you're able to reverse it, it's far more impressive than getting, transplants put into your scalp.
Yeah.
Is that kind of partially the motivation too, is that you want to do it by means of it's your own body functioning at a high level, facilitating the result more than, like, I don't know what your stance is on cosmetic procedures that are literally pure cosmetic.
Yeah. We've tried to not be righteous. We've tried to be open-minded, and anything that comes our way, we will contemplate. I know that there's this purist idea that you're only going to do regeneration, which we were largely doing that for the first little while, and that something like cosmetic surgery would be terrible. There's a lot of people who want to combine both modalities. So I'm actually more open-minded. I haven't done any cosmetic surgeries, but I'm open to them. It's not like we will say that we're drawing a hard line in the sand for any reason. Like, we're really after this endeavor of how do you evolve from Homo sapien to Homo evolutus, and are there rules to that game? Probably not. If we can try to avoid don't die, then that's really the ultimate one, which is why we carefully pay attention to risk. But of course, everyone's going to disagree on that risk profile.
Yeah. It's like the novelty factor on some of the hair loss prevention stuff to me just doesn't seem worthwhile when you can predict with reasonable accuracy that a transplant would be uncomfortable acutely, but get a far better result and have a lower drug burden with less contraindications to have to worry about. Like, the protocol you're on has oral minoxidil, which, it's not a high dose by any means. I'm not saying it's a super dangerous thing. And then there was a diclofenac or something, some other drug in your topical that I don't recall exactly what it is, but I often see people getting on like corticosteroids and stuff to try and quell the immune response they think is happening on their scalp, among other things. And it's like, I'm not, like, I don't have a transplant. I will probably get one day to avoid having to go on extra drugs to get to where I want to be. But it's kind of just like, I don't know. I feel like that might be
it's a fair stance. Like, absolutely respectable, cool, and I wouldn't come to the party with like a different opinion. Like, fine. Like we're all trying different approaches.
Hmm.
And I don't think, we've like, if I think back through the things that have been pretty negative, HGH was catastrophic.
Yeah.
I mean, I had intracranial pressure. It messed up my glucose. I had headaches. I had difficulty sleeping. It was just, I took it for 100 days and I never want to do it again.
What was your dose?
0.6 milligrams.
So 1.8 international units.
Yeah, exactly right. Yeah, 1.8. And
Okay.
it was 5 days a week. And I think now there wasn't, because there's the TRIM trial, which did that. And so we're replicating that trial. There's so many things we would do differently if we approached the thymus rejuvenation again.
Yeah.
We definitely would not use HGH.
What brand did you use, or do you remember?
Norditropin.
Yeah, HGH is interesting because sometimes even among pharmaceutical grade brands, you will find variable response from an edema standpoint and water retention and whatnot. But that's one of those things too, where it's like the minoxidil could just as easily have caused something similar with the edema, orthostatic hypotension for that, I guess, as opposed to hyper. But yeah, it's quite. I've had friends who've had crippling nerve pain from the water. It can get pretty hectic. Or people that need to go on diuretics just to keep on it, and because they're bodybuilding and think they need it, they will, be polypharmacy out the ass just to stay on their GH essentially. Yeah. So yeah, man, that's
my personal experience. I would never do it again, and it is not a lightweight decision.
What was your blood pressure while you were on it?
I think my blood pressure was fine.
It didn't change at all?
I don't think so. Or if it did, it's imperceptible.
Yeah.
But I guess, like, to your point on what is dangerous, what is dangerous, what is high risk. One thing we like is I get so many things measured at such a high frequency that we can keep side effects in check. And so with the HGH, we were able to quantify the negative effects so fully and so fast to see it. I mean, I can just list off everything that was wrong. And in doing the other things, we have a pretty good view of what's going on. So I know from a person's vantage point, they have these ideas after reading papers or being in forums and reading whatnot, and also hearing anecdotal reports of certain things. But I don't know if I can't think of another time where we've identified significant side effects from a given thing we've done.
Bodybuilders. For sure.
Well, I mean, they're the best ones to show us what really happens.
Yeah, you'll see at the extreme too. It's like self-inducing acromegaly level IGF-1 levels. Yeah, and they'll tell us what happens.
Exactly,
that happens all the time.
Yeah, but I guess, like, to your point, like, I guess what I'm trying to establish is whatever someone perceives the risk profile to be, we try to keep that risk in check with as robust measurement as possible. Now, some things we maybe create a larger unknown. Like, for example, I take a pretty high dose of rapamycin. And so that's immune suppression. So we can look at all the immune profile. We measure my immune system very extensively, so we can assess that. But, are we missing something in the measurement we should be capturing? So we really try to play very carefully in that line of never trading risk for potential gain.